Across our communities, neglected tropical diseases affect real people and real families. At the Kumasi Center for Collaborative Research in Tropical Medicine, we are working to change this through better diagnostics, robust research, meaningful capacity building, and partnerships that place people at the center.
KCCR supports faster, more accurate, and more accessible diagnostics for neglected tropical diseases by combining advanced laboratory science with field-based implementations. As a WHO reference laboratory for Buruli ulcer and an ANDI Center of Excellence, it applies microbiological and molecular tools such as PCR and sequencing to improve early and precise diagnosis. Through operational research, validation of point-of-care technologies, and training of peripheral laboratories and health workers, KCCR shortens time to diagnosis and expands access to quality NTD diagnostics across Ghana and the sub-region.
At KCCR, innovation is bringing hope closer to communities affected by neglected tropical diseases. We have led the development of field-deplorable real-time RPA assays and contributed to the evaluation of biomem diagnostic technologies for the rapid and accurate detection of Buruli ulcer, yaws, leprosy, schistosomiasis, and other NTDs with the added potential for multiplex identification. These assays have sensitivities comparable to real-time PCR, and also these innovations significantly reduce the diagnostic turnaround time and are tailored for low resource settings, bringing reliable and timely diagnosis to where it matters the most, at the point of care.
The filariasis project here at KCCR has worked over 2 decades trying to find a cure for the treatment of onchocerciasis and lymphatic filariasis. They have identified a drug that is macrofilaricidal, killing the adult worms of the worms that causes lymphatic filariasis, resulting in elephantiasis, enlargement of the limbs and enlargement of the scrotum. And aside that, they have also trained a number of health workers. That includes nurses, midwives, physician assistants, and even community health volunteers on how to assist with the management of the legs of people who are suffering from lymphatic filariasis. We at KCCR here have established 2 lymphedema management clinics in the northern part of Ghana, Katsina Nankana East and Katsina Nankana West. And these clinics are being mined by the trained health workers in the assistance of people who are suffering from elephantiasis. Aside that, people who have enlargement of the scrotum due to accumulation of fluid, which we call hydrocele, have had their hydrocele removed. Surgeries have been done for them, and they have been declared free of lymphatic filariasis as a result of the worm on the tunica vaginalis of the scrotum. KCCL has contributed enormously in removing nodules from individuals who have nodules as a result of infection of onchocerciasis. River blindness is the local name that is called, and there has been massive effects from that. Now we have very low transmission as a result of activities that have been undertaken here in KCCL, and we have only 2 districts that have the lymphatic filariasis infection in Ghana, because KCCL has worked tremendously to achieving great success in that regard.
NTDs affect people that are poor and vulnerable. But beyond the bodily representation, these are people that are complex in nature, coming from communities that have unique norms, values, and understandings. And so to create a lasting solution to the NTD problem, there is the need to combine the social with the biomedical. At KCCR, we integrate community engagement, social science, and One Health approaches to understand how social constructs like stigma, gender norms, and economies shape health decisions. We work very closely with community health volunteers, health workers, affected persons to co-design interventions that they can trust and accept. By listening first, we improve community awareness, we reduce stigma, and we promote early care seeking.
KCCR contributes to a transformation of laboratory discoveries into clinical care. By conducting phase 2 and phase 3 clinical trials that shift global treatment standards, KCCR has, for instance, transformed brulee ulcer care from surgery to oral treatment. As a One Health pioneer with world-class BSL-3 facilities, KCCR conducts NTD clinical trials, including snakebite envenoming, and deploys mobile suitcase labs for field diagnostics. This precision research converts neglected tropical diseases into manageable conditions, ensuring national health policies are driven by robust clinical evidence.
At KCCR, we build capacities through partnerships and world-class training up to the postdoctoral level for both local and international researchers. By hosting the African Research Network for Neglected Tropical Diseases and leading Pan-African consortia such as Takeoff, Alert, and Adapt, we harmonize clinical standards and research protocols across the continent. Our open international platform allows us to prioritize training of early and mid-career researchers. Through initiatives like the Small Grants Program, we ensure that the next generation of African scientists can lead high-stakes research independently. These efforts directly support the 2030 NTD roadmap goal of moving from neglect to elimination.
Ending NTD requires integration. WHO's vision calls for country ownership, multi-sectorial collaboration, and patient-centered care that addresses the disease and the dignity of the patients. Together, through shared commitment and coordinated action, we can achieve the 2030 targets, leaving no one behind in our pursuit of health for all.
Join KCCR and partners as we push for science, equity, and action, leaving no one behind. World NTD Day. Unite, act, eliminate.